Thank you for attending this breakout session. This session is filled with powerful information to help improve your health and empower you. Radio Free 102.3 KJLH. We are you.
Hello, everyone. Welcome to the 21st annual.
Wait, time out. It didn't record. Hold on. It didn't record.
No problem.
Okay, in 3, 2, 1.
Hello, everyone. Hello, ladies. It's Ade Lamar here with the Steve Harvey Morning Show. Welcome to our 21st annual KJLH Women's Health Expo. If I know you, you've been plopping around on this website, getting all the great information, and you stopped right here because this is where you're supposed to be right now. This information is so important. I'm so excited to have two of the creme de la creme experts to talk to us. We've been chatting so much about COVID. That is what our theme this year is about. Your health through the lens of COVID. Well, we're coming out of it. It seems like we're doing really well as far as, at this point, California being the lowest case rates in the country. That's big news for us. That's big, and we're really excited about that. That means more things are opening. But are we moving too soon? Everybody wants to know what's happening, what's next after we've been through this pandemic. A lot of folks have been shaken up. We all have been shaken up. So we decided to have two of the best people to come in and chat about this, two experts. And my very first guest, I'm so happy that she's here all the way from, let's see, or is it Harvard? You're all coming all the way from Harvard with us? Oh, yes, I love this. I love this. She is the professor of epidemiology. This word kills me every time. Epidemiology. Say it for me.
Epidemiology.
Epidemiology.
Yeah.
Epidemiology at Harvard, the School of Public Health. And we are so excited that you're here because we're looking for answers. Everyone's trying to figure out what's happening. Should we get vaccinated? Where do we start, in your opinion? Where do we start?
Fantastic. Well, I've put together some slides that talk about some of the most recent data, both around statistics around COVID, as well as where we are in terms of the vaccine. So maybe I could start with sharing some slides.
Let's see.
Perfect. And it's really an honor to be here with all of you and to be part of this important Women's Health Expo. So thank you so much for the invitation. Where are we in terms of statistics? And so, first of all, there's a number of reliable resources now of information about the number of cases of COVID-19, the number of individuals who are hospitalized and deaths. The website of where I'm presenting right now is from Johns Hopkins University, and they have a very nice web platform. So if you want to take a look, you can look at both data around the globe as well as within the United States, looking at the state level. So as of yesterday, there were 32 million COVID cases that have been diagnosed throughout the United States since the pandemic began. And actually that number globally is 148 million. Unfortunately, in the United States, also more than 573,000 individuals have died of COVID-19. And again, the number globally is 3.1 million. So you can see this map here shows the hot spots around the world of the countries with the highest number of COVID-19 cases. And the United States is first. India is second. You may have heard in the news, there's a lot going on in India right now with COVID-19, and then Brazil has ranked third in terms of the total number of cases. These are also data from Johns Hopkins University, and I just took two snapshots of sort of what are the trends over time since the pandemic began, which we really sort of think about starting around March 2020 in the United States. So these are data from New York State. And as you can see, New York, and this is the number of deaths from COVID-19. The New York and other New England states really saw some of the first wave of this pandemic, really sharp peak that started in March and peaked out in the middle of April and then came down. And then unfortunately, we had that second wave around just after Thanksgiving. And in total in New York City, 52,000 individuals have died of COVID-19. And then I thought, since many of you are in California, that you might be interested in this information as well. So very different pattern. And I think that's what's been very important to understand with this pandemic is what's happening at any one time across the country. It's been very different. So not much happened in California until, again, after Thanksgiving. And then there was that very virulent variant of COVID-19 that hit California. As you said, now deaths from COVID-19 are really decreasing, but in total, unfortunately, almost 60,000 individuals in California have died of COVID-19 as of April 6th. So I also just wanted to share some data, I think that really gives you a sense of the public health burden of COVID-19 in the population. So right now, I think COVID-19 ranks about 5th or 6th in overall causes of mortality in the United States, just after cardiovascular disease and cancer. And as a result of so many people dying, US residents have actually lost a whole year of life expectancy, but that's actually really different in different subpopulation. So unfortunately, Blacks are experiencing 2.1 greater life years lost, and Latinos are experiencing 3.1 years life lost because of the pandemic. So this pandemic has really hurt in certain subgroups of the population really harder.
Wow.
And again, this is data looking instead at age, and this is again looking at COVID-19 mortality rates. And so what you can see here is that the mortality rates, if we think about 18 to 29-year-olds being sort of the comparison group, if you're in your 50s and 60s, your own risk of COVID-19 death is about 30 times higher. If you're in your 60s or early 70s, it's 90 times higher. And you can really see that age group of individuals 85 and older, much, much more likely to have died of COVID-19. So a lot of research, and I know Dr. Robinson's going to be talking about what are some of the reasons this pandemic has hit some populations much harder than others. So I think that'll be really interesting to hear Dr. Robinson's comments on that. So I was asked to talk about where we are in terms of COVID-19 vaccines, or vaccines against the virus that causes COVID-19, which is called the SARS-CoV-2 virus.
Yes.
And I wanted to present a timeline because I think this is something that people have talked about, concerns about safety. Well, wow, they've moved the COVID-19 vaccine so quickly. Is it really safe? So I just wanted to give you a comparison to two other vaccines. One is for polio and one is for Ebola. Polio was actually the first epidemic in the United States for polio was actually in 1894. And it actually took 60 years before they were able to develop a vaccine. But that was really also because this was one of the first vaccines ever created. And so they were really learning about the process. Ebola, which really one of the first pandemics hit in 1976, they sequenced the genome in 1993. It then took about 15 years to develop a vaccine. Here we are, with the pandemics really starting in parts of China back in 2019 at the end of the year. We were able to sequence the whole genome in 2 months. And that's compared to, 20 plus years for Ebola. So just to give you a sense, we're so far ahead scientifically. Then in addition, what the developers of these vaccines did was they, instead of sort of sequencing the gene, developing a vaccine, doing the trials, they actually did a lot of this work in parallel, which allowed them really to expedite the whole process. So I think I just wanted to say that it's so wonderful to see how science and scientists came together to make this happen. So around the globe, actually, there are 8 approved vaccines for full use. Of course, in the United States, we only have 3 approved vaccines. We have the vaccine that you might have heard from Pfizer or BioNtech. We have a vaccine from Moderna. That was the second one to come on with approval. And then the third approval was Johnson & Johnson. But around the globe, there's actually 8 vaccines that are approved for full use. And then there's 2 vaccines that are currently in pretty advanced stages of development. So they're in what we call the phase 3 randomized trial. And that's where they're testing in tens of thousands of individuals, and they randomly assign one group to get the vaccine, one group to not, and then they compare rates of COVID-19 incidence or symptomatic COVID-19 and see if there's differences or not. And then there's another 101 vaccines that are different stages of testing. So this has been, again, a really incredible feat to bring all of these, governments together with scientists, biotech companies, pharmaceutical companies, all working together on this. So I wanted to also talk about just the 2 different types of vaccines that are now being used in the US. The first are what we call the RNA vaccines, or this is where actually the vaccines, and this is both Pfizer's vaccine and Moderna, what they've done, it's an incredibly clever technology. They allow for a very small piece of what's called RNA. And RNA is what makes proteins that then tells the cells, hey, keep an eye on this, develop an immune response to this, so that when you actually see real COVID-19, your immune system will be prepared. So this is the technology that's used for both of these. It really is a new technology. Some people have asked me, well, can I get COVID-19 from this? Absolutely not. This is just one very small piece of RNA that tells the cells to make an immune response, and then that RNA quickly degrades. It can never cause COVID-19 itself. The Johnson & Johnson is more of a traditional vaccine, where what they've done is to take one of the proteins, what they call the spike protein, from COVID-19. That's the protein that allows the virus to get into cells, and they put it inside another sort of engineered virus. And this is a technology that's been around for a long time. So that's the Johnson & Johnson. Both are very effective. I'll show you in a second, but I just wanted to kind of show that. So again, I thought it'd be helpful. Well, how do we know these vaccines work? Well, it goes through many different stages of testing. First, it's tested in animals, then it's tested in a very small group of individuals to make sure there's not side effects. Then it goes up, and then the final step is a large randomized trial. So this was the design of the Pfizer or BioNtech vaccine. They had 43,000 individuals who were ages 16 and older. Then the scientists randomly assigned half the group to get the vaccine and half to get a shot of something, but it was nothing in the shot, so it was a placebo. The scientists giving the vaccination didn't know who was getting the real vaccine or not. The participants themselves didn't know who was getting the vaccine or not. And that blinding is really important to make sure this is a valid study. So then they followed individuals on average about 2 months, and then looked to see who had been diagnosed with laboratory confirmed COVID-19. And I just wanted to show you what the study population looked like. About half of the population was men, half was women. This study tried to have a diverse population. So 83% were white, 9% Black or African American, 4% Asian, and 28% Hispanic or Latinx. And then they were recruiting participants across different countries as well. And just to give you a sense, the Moderna trial actually did a slightly better job at getting a really diverse population of participants. And I think that diversity is important, not only in this type of trial, but all the types of medical trials that are done. And so here's what the results actually look like. So the line in blue are those participants who were on, who just got the placebo. So they didn't have any real vaccine at all. And then the red line looks at the group that was randomized to the vaccine. And what you can see is you have a much, much higher incidence. So 162 cases occurred in the placebo group compared to the 8 cases in the vaccinated group. That then allows us to estimate the 95% effectiveness of the placebo. So it wasn't zero in the vaccine group, but it was much, much lower than in those who didn't get the vaccine. So it was 95% effective. And they also looked to see what it was similar in men and women. And then it was also similar across racial ethnic groups. So it was very, very effective. There were some side effects. Most of these resolved pretty quickly. Very, very rare side effect was 11 cases per 18 million vaccines. So 18 million vaccine doses were given, and there were only 11 cases of this most severe side effect of anaphylaxis. So I just wanted to put this table to give you kind of all three of the vaccines together, who can get it, how many shots do you need, how long do you have to wait till you're fully vaccinated, and what does that effectiveness look like? So Pfizer, we already talked about, it was included individuals 16 and older, so that's who can get the vaccine right now. Although they are completing a trial now of kids 12 to 15, I think that's going to be a really important study. So with positive trial results, they'll be able to say 12 to 15-year-olds can get this vaccine. 2 shots given 3 weeks apart, and you're fully vaccinated after 2 weeks. And as I said, it's 95% effective overall and 100% effective against serious disease. Moderna's trial was, the age range was 18 years old. So if you're less than 18, you cannot get Moderna. They actually have, though, 2 trials that are ongoing. It's going to take a little bit of time before we see the results, though. One is focused in 12 to 17-year-olds, and another is focused on 6 months to 12 years old. A little different, there's 2 shots still, but given 4 weeks apart. You're vaccinated 2 weeks after your second shot. And then it was 94% protection against symptomatic disease, a little bit lower in that older age group. Then finally, Johnson & Johnson, again, it's who can get it is those 18 and older, only takes 1 shot though. It's also much easier to store. So there's a lot of advantages to the Johnson & Johnson shot. Because it's just 1 shot, you're actually fully vaccinated 2 weeks after that first shot. People have talked a lot about these numbers being, well, they look a little bit lower. The effectiveness, 72% overall, 86% for serious disease. How you interpret this is, it's a little hard because the Johnson & Johnson trial data was reading out at a time when a lot of surges were happening, for example, in the United States. So it's almost not quite a fair comparison. But I think 72% effectiveness, 86% for serious disease is quite good. And then finally, I just wanted to make a comment about pregnant women, because I think this is a question that women ask. Well, if I'm pregnant, is this safe for me? So the trials initially did not include pregnant women in the design of the trial. And that is common because, of course, women who are pregnant, you want to make sure the safety is there. And so there was little human data on the safety during pregnancy that was available at the time of authorization. And then the reason this is so important, it looks like actually women who are pregnant and have COVID-19 are actually at increased risk of severe illness and death. So I think addressing this question is really important. Well, we have some new data actually that just came out in this month, looking at, it wasn't a randomized trial, it was they were just observing women in a system that was set up by the US Centers for Disease Control. Basically, it was a smartphone-based system for tracking how people were doing after the vaccination. And it published data specifically on women who were pregnant. And what was important to see was women who received a vaccine during pregnancy were no more likely to have complications with pregnancy. They were no more likely to have a preterm birth. And there didn't seem to be any impact on death or even any sort of congenital malformation. So I think this is really, really good news. And I think it's going to be important to see what happens with the recommendations about vaccination for pregnant women. So thanks so much. I would love to talk with you more about this. And I have a slide, let's see. Oh, sorry, here, if you want to talk about some, I know some frequently asked questions, so, but I'd love to hear some thoughts from you.
Well, I tell you what, Dr. Mucci, I love how you broke it down and where everyone can actually see the statistics, see what's happening, breaking it down for us to let us know, because everyone was concerned once the vaccine came available. You know, everybody was happy at one point, but then they were so concerned because we've heard how long it does take to get a vaccine. And when you tell us and explain to us where we were already in the process, it makes a lot of sense. So a lot of people can calm down their nerves on that. When we talk about the vaccines, I wasn't aware that there were 101 worldwide that we were working on. So much information. And then, of course, the two major ones that we've been dealing with, Pfizer and Moderna. But then Johnson & Johnson was pulled. Everyone was, but we're now using it again. Why was it pulled? Could you explain that a little bit to us?
Yeah, no, absolutely. And I actually, at the bottom of this slide here, talk about a little bit what happened. So what happened was, and this is why we have these monitoring systems. So like the CDC's smartphone app is to monitor across the population to make sure there's not side effects. So what happened was in February 27th of this year, there were reports of it turns out to be 6 cases. They were all in women between the ages of 18 and 48 of severe blood clots that occurred very soon after these women got the vaccine, so between 6 and 13 days. So what they did, which was what you should do in any new either drug or vaccination, is they halted giving additional people because they wanted to make sure there was not a bigger problem. They investigated it carefully and did not see that there was any bigger problem. So I think what's important is that it is a rare event, just like with the Moderna and Pfizer vaccine. A very rare event is an anaphylaxis event, very rare. So, you know, and just to give you a sense, you know, women who take oral contraceptives can also be at risk of getting a blood clot. And that risk is actually higher than it is for this vaccine from Johnson & Johnson. So I think that just goes to say, it's something to think about.
Right.
Most, you know, given how many millions of vaccine doses have been given, very, very few women were impacted. I think the other way to think of it is most women were not impacted by this. And I think a lot of research needs to go into why is it happening, and can we figure out which women might be at greatest risk and tell them not to get the Johnson & Johnson. But I think for most people, this is a very safe and effective vaccine.
Well, I think you're right, Dr. Mucci, because that's the way it is with birth control pills. The way you said, your doctor talks to you and asks you about certain things, and then they choose which one would better fit you. So that would be with the vaccine as well.
Yes, exactly.
Okay, I like that. I like that. Okay, so when we think about the vaccines, and we're being told to get the vaccine, but they're not really sure how long it will protect us, if there will be a booster. How long do we really know how long, or does it vary with each individual?
Right. And do you want me to stop sharing the slides here?
Sure.
Okay, perfect. Yeah. Then we can sort of see each other. Yeah, no, I think that is that is a really important question. And again, we are all learning. And again, just to this idea, I have never seen in my whole time in epidemiology and public health, a scientific community come together in such a way and tackle a public health issue. So I think we're learning things rapidly, quickly, but also validly, if that makes sense. So I think we're still learning a lot. But right now, I think the thought is that probably it's going to be about a year of effectiveness It depends a little bit about, I think we've talked a little bit about these variants of the virus. So basically what's happening, and this happens with viruses, they can mutate and develop new features. Again, with the virus that's happening right now in India, it seems much more able to avoid the immune system. And that is seeming why it's so infectious. And so I think we have to see, are these new variants going to make the vaccine last less than a year? And then I think the other thing that there's some very new data that suggests that if someone has a prior infection with COVID-19, it may protect them around 8 months. So I think that's another message, is that even for women who've been previously infected with COVID-19, you still should get a vaccination yourself. Your doctor will tell you there should be an amount of time you want to wait until after your initial infection before you get vaccinated, but highly, highly recommended that all people, regardless of whether they've gotten infected directly or not, should get this vaccine.
Well, when we talk about the variants, it really does remind me of the flu, because each year we have to get a flu shot. Do you think that's kind of where we're going, where we're going to need a COVID shot once a year or something like that?
Yeah, I think that is how experts in vaccines are thinking about this. And it might be, just as you say, just like the flu, when you get the flu vaccine, it's not against just one variant of flu. Right. Oftentimes they'll put 2 or 3 or more in that same vaccine dose. So it's probably going to be very similar to that.
Okay, so this just came out, and I'm throwing this question in because the CDC has made this new guideline. They're very slow to really put something as a guideline, and I understand because they don't want to pull back. But now they're saying if you've been fully vaccinated, one, we have to understand that fully vaccinated doesn't just mean your second shot. You got to wait that 2 weeks after the second shot if you're getting the Moderna or the Pfizer.
Yeah.
But they're saying that we can now walk outside with no mask.
Right.
And they put it in the guidelines. Yeah. What do you think about that?
Oh gosh, I may get into hot water with my thoughts about this.
Into it with you.
Right. So, I think that recommendation brings hope, right? That things are going to return to normal. I think the challenge with that recommendation, from my perspective, though, is how do you know who's walking down the street who actually is vaccinated and who is not? And because actually, right, yeah. So I think it's going to be really challenging. And so myself personally, when I'm walking in nature, I'm not going to be wearing a mask. But when I'm walking down the street in my neighborhood, around shops, I'm still going to be wearing my mask, because I do think it's just hard to. So is that your thought as well?
Exactly. That's exactly what I thought. I did the story this morning, and I was telling people, I said, okay, this is what they're saying, but we got to think. Yeah. It's on the honor system. And I don't know, people are really not filling these masks enough for the, I don't think people that even, I don't think the honor system is the best way to go with this. And I think that they should think about this again, because just as we started out in the beginning and they were telling us we didn't need a mask, only the people that this needed a mask, I think we need to think about this and use a little common sense and just be careful, because we got to take some precautions. We just have to do it. We just have to do it. Yeah.
And I think, masks now, I sort of think of it like bike helmets for kids. My son is a teenager. He never thinks not to wear his helmet. It's just what he does. And I think it's the same thing with masks now. We all sort of have gotten used to, we're going outside, let's put a mask on. So it's a very low thing for us to do that ultimately has really shown to be an important public health measure in this fight against COVID-19.
Well, I think it's going to be one of our permanent accessories for quite some time.
Yes, right. That's right.
Get to it, folks. Bedazzle and do whatever you want to with the mask, but wear them.
That's right. That's absolutely right.
I have certainly enjoyed talking with you. I could talk to you all day. I feel like I'm getting a good a lesson from Harvard. I'm sitting in class with you. I love the slides. I love that you brought information that we can actually see and go along with. And I know the ladies are excited because they can go back and look at the slides individually yourselves. Just thank you for being here with us and sharing your knowledge and wisdom.
Oh, my pleasure. And I'm going to be sharing my slides, and on many of the slides, there are the web links, and the websites are wonderful. You really can interact with them and look at the things that are most important to you and the community that you live in. So thank you so much. It's been a real pleasure.
The Radio Free 102.3 KJLH 21st Annual Women's Health Expo, brought to you virtually by the City of Long Beach and Fresno County Black Infant Health Program.